First one I'm going to bring up here is Dr. Marshall Longwell. He's an ER doc who's actually one of the first people who participated in Camp Tiger. He's really done great work for the camp, not only when he was a student, but every year since he's, I guess, become a real person. And with that, he's one of our biggest benefactors every year. He really helps us out, and he's going to give you a few. He's actually going to tag along with us for Camp Week to make sure that the campers are as safe as they can be. So please give your attention to Dr. Longwell, and he'll give you a rundown of what he's going to expect from y'all for the week. And camp is May 21st through May 25th, by the way.
Hey guys, I'm Marshall. Nice to meet you. I'm the other Dr. Longwell. My wife is also doing the camp with us. She's a PhD psychologist. So of the two of us, you'll probably utilize her more than me. Who am I? Let's see. I'm the medical director of Camp Tiger. This is my 7th day at camp. There's like a couple of guys, buddies of mine from medical school, and we've done this forever. It's a blast. Priority, have fun. I will admit to y'all that all the first group make me feel old. I and one of my best friends, who's now the head of the cath lab at LSU, we had an infamous night out, which involved me getting excessively intoxicated in front of his now wife's adolescent little brother, and he's an L1 with y'all. So he's now grown up. I was like, he's in medical school? He's like, go tall. Great. Okay. First day team will be there'll be Dr. Quo. He's the other medical director. Dr. Quo's younger brother is ill, so he's going to be missing a couple of days out of the middle of Camp Tiger. And Greg Fernandez and my wife. We'll also have an EMS unit there. We get in a Acadian ambulance for the week. My job is usually pretty simple. But we do depend on y'all to do a few things. Okay, things you need to know about your camper. These are important. Okay, they're not. Hopefully, they won't be important, but I'm going to depend on you because there are so many obscure diagnoses with these children that we're not going to know them all. Okay, or at least I won't. You need to know your own camper's diagnosis. Okay, you need to know their primary diagnosis and their clinical features. The reason I say primary diagnosis is find out. Okay, my camper has autism. Okay, how many people know children with autism? Yeah, my 4-year-old's got autism. So if you've met one autistic child, you've met one autistic child. There's so much variability. So you need to know the primary diagnosis and also what they're actually like, what features they have issues with. You need to know all their past medical history, not just their primary diagnosis, allergies, meds, other complications. They've had, seizure disorders, stuff that backs up that primary diagnosis. Any possible life-threatening complications. I'll never forget, we had a girl one year who doesn't sweat. Okay. Well, we had her out to fly, and all of a sudden she started acting a little funny. It's because she was uninsured. So it was one of those I didn't know that until the camper came up and said, hey, or the counselor said, hey, she's not acting right. So please know the diagnosis, what clinical features, and the issues that have happened in the past. A lot of this, my wife sent her talk along as well. How many people know what a school psychologist does? One. Awesome. Because I have no clue. I almost married the woman who had no idea what she did. So until our first Camp Tiger. And then, so I'm watching this kid beat the crap out of 2 counselors. And you've got L1 med students who just finished their exams, are feeling awfully proud. And they've got this child beating them down. And they just look so, I'll pop up to my wife, pull this Jedi, sit down, eat pizza, move on. And trust me, these kids will be humbling, okay? How many in here have children? Okay, so, yeah, any child will be a challenge. Children with special needs, are a little bit different breed. Okay, so we'll get you her phone number, keep her on speed dial. That way Jeannie can help you when you need it. Okay. Also, same event was disturbing, and I realized she does the same thing to me at home. When you're a psychologist, it's tough. Okay. Allow us to be the bad guys as far as intervention. Y'all want to prioritize having fun. These kids, first, they get a break, they get something new to do, their parents get a break, they're out to have fun, you're out to have fun. Someone's got to be the parent. Okay, someone has to be the person saying no, someone has to be the person stepping in. We have no problems being the jerk. Okay, so if things are getting out of hand, contact the medical team, and we can be the bad guys. The timeouts, people don't like being stuck without my wife, so if something's going wrong, just call. Sorry, back to things we need to know. Please ask who the primary care doctor and primary hospital of choice for your camper. In case something happens, I need to know who to call to get medical information and which hospital they would have gone to. And we may not be transporting to that hospital, but that's important stuff. Okay. Communication level. We need to know your child's ability to communicate, how they communicate, if they have any special meanings for things. The story I use for this is we had a child who was, I think he was 16 when this happened, who we went out to the emergency department because he said his penis hurt. Okay? Great. Counselor came up to me saying, he's yelling, saying his penis hurts. Couldn't get in touch with mom. We wound up in the ER. And came to find out that he had been potty trained at age 14 and realized that when he said his penis hurt, everything stopped. So he started using it as his escape mechanism. He would go like, my penis hurts. Well, the whole thing stopped. Probably still stopped as an adult, but that's how we wound up in the emergency department because I didn't know that whole feature. Okay, so if they have a certain escape port, something they use to get out of stuff, what we can get to use them to comply. How we got this kid to behave, took a cell phone, put his mom on the cell phone, handed it to him, and his mom talked to him for about 30 seconds, and here, okay, yes ma'am. We went right back to doing our stuff. Okay? So those quirks are important. Also, phobias and obsessions. Phobias. We had a camper, Clifford Big Red Dog. Okay, which, except can't try to hire Clifford Big Red Dog to okay. So this poor girl was trapped in an upstairs part of the Children's Museum. Clifford's downstairs and wouldn't come out of the corner until Clifford left the building. Okay, we also started Clifford because we were like, dude, you gotta go. Seriously, yeah. Obsessions. You can use obsessions, and also you need to be aware of them. We had an autistic teenager who was obsessed with dogs, bikes, and golf. Okay, so first day, this was actually my year as a counselor. The two guys that were with him got the crud beat out of them. They just, but they clued in. And the next day, they used his obsession with golf. They brought with them a golf catalog. So if you didn't want a bus, they let him shop with a catalog. And one of them would be the auctioneer or the credit bureau, and the other guy would be the person helping him shop. So that let him have it commercial, they'd be like, hey, can you get the golf bag with that? Let him have it. He didn't have blinds. So use obsessions. Also, we didn't know, let's say, we also had an event where we were by the golf course. Where do you think the kid ran off to? He just took off down chasing golf carts. So it's important to those obsessions. Okay, EMS. We do have an EMS unit. We fully stocked with emerging drugs. Please do not go to them for minor emergencies for you. Oh, in general, I treat more counselors than I treat killers. Okay, I do. I will be carrying over-the-counter pain medications like Tylenol and ibuprofen. It is appropriate. If you're hungover, you need something, I'm okay with that. Don't judge. Okay? minor allergic reactions. We had someone get a Benadryl shot last year because she had a minor allergic reaction, which is okay, but we're paying mini bar prices for that. So I can give you oral medications off curing Benadryl, okay? So if you have any kind of special medical issues, please let us know now. Like if you have anaphylaxis something, I'd just like to know that. Restraining people. Any guys over the age, over the height of 5'11" and weigh more than 200 pounds, raise your hand. Okay. Oh, come on, raise your hand. It's not a fat joke, let's go. Okay. So, guys, we do our best not to restrain people. But if it's an issue of safety, we will. And I'll do my best to be present. This is not something you do to. The key to this is being firm, but not forceful, staying calm, and trying to make the situation calm down. You have one person at each extremity, above the joint, below the joint, and hold pressure to restrain. If I ask you, I need help now, that means you're drafted. Okay? So we haven't had to do that in a few years. Okay, warnings about games. You're gonna have a lot of fun playing with these kids, but please think ahead. Games that don't make you feel warm and fuzzy. Chase is a lot of fun. Until we are, down here in this breakfast area, kids are running out into traffic, and their counselors are chasing them, and the kid doesn't realize that it's no longer, haha, tag, it's, oh blank, my kid's gonna get hit by a car. Okay, so remember, think about whatever game you're playing, what are you reinforcing? What behavior are you reinforcing? The reinforcing of something, running away from this guy is fun, may not be too healthy at the alligator farm or in traffic. So try to think ahead. Also, use the parents as your allies. These people, we live with these kids every day. Ask them, special behaviors, special problems going on right now, age-dependent issues. Puberty sucks, okay? Think about how bad you were 12 years old, going through puberty. What about a special needs child? Just be aware that, be cautious of inappropriate behavior or inappropriate thoughts because, it happens. Let's see. Oh, last point from my talk. Guys, knock this out of the park. This is how we judge the L1 class. Okay? You're Camp Tiger. Don't screw up Camp Tiger. Do not screw up Camp Tiger. This is all the alumni will remember. Okay? I covered most everything on my wife's talk. Her big thing was she wants to make sure that you read the whole application for your camper. The more you know about the camper, the safer things are going to be, the easier it's going to be on you. Let us be the bad guys, because that's what we're good at. What's the definition of insanity? According to Einstein? Doing the same thing repetitively and expecting a different outcome. Okay, Einstein never had an autistic child. Okay, because you would be shocked. You can do the same thing, and then boom, something changes. Sometimes it just takes a different person. You can handle everything perfectly, and still the child not respond correctly. If something's going wrong, please get us. Triggers. Make sure that ask the parent what triggers bad behavior. Common things that you may not realize because you don't have this issue. Most college kids don't. Transitions from one activity to the next stresses kids out. Okay? They just got happy playing with this ball, now it's time to go. That can trigger bad behavior. Food, like they're hungry, thirsty. Ask the parents, how they act out and what tends to be their triggers for bad behavior. Praise good behavior. my wife does not do this at home. You should say 6 things good for every bad thing you say. I keep reminding her of that. It just doesn't work out. Reinforce the good. That way, when you have to correct, it's a change. Okay? Have fun, be safe, and once again, if anything goes wrong, please feel free to call us. We both have. I go by Marshall. She goes by Jenny. That way, you say Dr. Longwell. It's always funny because I start at the beginning of the week and I always get calls for Dr. Longwell, and that's the end of the week I mention the phone and they're like, no, where's your wife? Okay. So, Phil, you need us, just